So a virus is on the rise, lots of injuries, and the heat is having an impact too. Our Dr. Frank McGeorge is here with a closer look at what's going around near you.
A virus on the rise, lots of injuries, and the heat is having a big impact too. I'm Dr. Frank McGeorge. I'll show you what's going around near you and an illness that parents in particular will want to be on the lookout for. In Wayne County, Dr. Jennifer Stevens-Hoyer at Henry Ford in Plymouth is among those seeing a spike in COVID infections. She says most are mild, though people still feel unwell. Some older patients are requiring hospitalization. Corewell Health Dearborn also reports a COVID upswing and outdoor injuries. Dr. Tiffany Widener at Children's Hospital is treating upper respiratory viruses, sinus infections, seasonal allergies, and a few kids with scarlet fever. Moving to Oakland County, Dr. David Donaldson at Corewell Health Beaumont in Troy is seeing quite a few COVID cases causing gastrointestinal symptoms, plus several sports injuries. Dr. Tim O'Neill reports some COVID along with cases of croup and stomach viruses. West of Washtenaw County, Dr. Brad Uran at the ER at Michigan Medicine is also seeing rising numbers of COVID cases, including some that need to be admitted to the hospital. They're also treating other upper respiratory infections and the flu, plus asthma and COPD flare-ups triggered by weather changes and those upper respiratory infections. Heading to Monroe County, doctors at ProMedic and Monroe Regional are treating some heat exhaustion related to the Monroe County Fair. They've also seen several patients with the flu and abdominal pain. Finally, in Macomb County, Dr. Maria Samuel at Henry Ford Sterling Heights reports patients coming in with COVID, poison ivy rashes, and sunburns. In McLaren Macomb, Dr. Stephen Yester is also seeing a noticeable increase in mild cases of COVID, plus seasonal allergy symptoms, lots of outdoor injuries, and a few stomach viruses. Now, going back to that scarlet fever in Wayne County, it generally begins with children complaining of a sore throat, then developing a rash that has a fairly classic sandpaper feel. Now, the good news is it is completely treatable with antibiotics. Now, at one time, scarlet fever did lead to lots of complications, but these days with antibiotics, it rarely causes long-term issues. If you or your child has a combination of a sore throat, fever, and a rash, you should talk to your doctor. Back to you.
All right, Doc, now you can read more advice from local doctors about how to avoid the illnesses and injuries that are causing problems right now at clickondetroit.com. All you have to do is search what's going around.